Good afternoon, everyone. We'll be starting in just a moment. I'll let you log in and get your sound on, and then we'll begin in just a few moments. Seeing lots of people coming in. And so with that, I will begin our webinar today. So good afternoon, everyone. So welcome to today's industry showcase. We have partnering to craft a population health management approach for cardiovascular disease in Alberta. And today is April 23rd of 2024. So my name is Amanda Delory. I'm the Member Programs Coordinator here at Digital Health Canada, and I'll be hosting you today. I'd like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We gratefully acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. So please take a moment to share in the chat the territory that you are joining us from. And just on a technical note, please use the chat or the Q&A if you're having any technical difficulties, and I'll be happy to help you out. And we'll also have time for Q&A at the end of the presentation. So please submit your questions at any time, and we'll be sure to address them at the very end. All right, so it is my pleasure to introduce our presenters. We have Dr. Kimberley Simmonds. Dr. Simmonds has a PhD in hospital epidemiology with expertise in research methodology, infectious diseases epidemiology, and surveillance. She has worked in a variety of healthcare settings and roles in Canada in the private and public sector. In 2020 and 2021, she was the analytics and modeling lead for the COVID response team in Alberta. Most recently, Kim was a senior manager with EY's National Health Team. Kim is also an adjunct professor at the University of Calgary. We also have Vinna Vong. Vinna Vong is the Executive Director for Patient Experience and Innovation at Novartis Canada. With over 20 years of experience in the Ontario public sector and digital health space, she has worked closely with key system partners to develop and implement strategies and solutions for digital health transformation. Before joining Novartis, Vinna was a digital health leader in the technology transformation and national healthcare practice at Ernst & Young. In this role, she served as a trusted advisor to provincial governments and healthcare organizations across Canada. Her focus was on enabling a more future-focused approach to care delivery and improving health outcomes through the use of data, digital solutions, and innovative partnerships. All right, if you could put the next slide, please. I just wanted to let you know that today's industry showcase is brought to you by Novartis. So thank you very much to Novartis for sponsoring this session and bringing together this thoughtful discussion. All right, so thank you all for coming today, and I will now pass the mic over to you, Kim and Vinna, to get started.
Thank you so much. So thanks everyone for having me. Currently, my role is ADM of Strategic Policy and Performance for the Government of Alberta. And we are super excited to talk to you today about the partnership that we started with Novartis and hopefully give you guys some insights as to how Alberta likes to partner with our colleagues in the private sector. So, the first thing I want to talk to you about is refocus. I think for those of you who are involved in the health system, you might have heard that Alberta is shifting from one mega regional health authority to 4 organizations that are specifically going to be based on the sector. And the reason for this is to have each one of the sectors aligned in terms of their ability to have high quality, strong accountability, and innovation within each one of those sectors. And so with this change is giving us a huge opportunity in the back end to do the things that I'm most passionate about, which is integration of digital and data, and that transformation to help us really be the best health system. So if we think about some of the challenges that exist in the system, that is really the impetus for it. So if we go to the next slide on challenges, I can just talk to you a little bit about what's been happening. So right now, we have issues with our data governance structure. And with one health provider, it was really difficult for other healthcare providers to be able to access data. For those of you in the private sector, we know that there's been issues in terms of inconsistent procedures and processes for how we can partner with organizations. And we didn't have a system that facilitated collaboration. Everything had to go into Alberta Health Services to be able to do things. And it was a bit tricky. And Alberta Health Services has done a phenomenal job of moving forward with innovation with their areas like strategic clinical networks and all kinds of other innovative ways of doing things. But with a giant system like this, it made sense to refocus and try some new things. And then the last thing I just want to mention is, as part of this, there will be the opportunity to do some modernization of legislation, which I think for anyone who's tried to work with us with our privacy impact assessments, the Health Information Act, it can be cumbersome. So with that, I think the exciting thing that's coming forward, and we have a ministry, technology and innovation we're so excited to continue to partner with. They have really helped us understand the value of data partnerships and partnerships more broadly. And so if you look on the left-hand side of the screen, you can see some of the value and principles that we're trying to adhere to. And I think when we partner with groups like Novartis, we learn. And so every time we're a learning system about how to do things better and faster. And so one of the things that is most important is making sure that Albertans get the best healthcare and the best outcomes. And driving innovation and partnering allows us to do this, right? So empowering Albertans and communities to make good decisions, sharing and understanding what is going on with the health system, what's going on with specific areas of focus like cardiovascular disease. And then making sure that we're focusing on, the way forward, a digitally enabled future, data-driven decision-making, and then that everything we do has a clear governance, it aligns with our strategic priorities, and that we don't get siloed into working in health, right? I think if we've learned anything from COVID, it's the importance of social determinants of health and things outside of the health system. And so we are now going to embark on partnering with other ministries, other groups, NGOs, to kind of understand more what's going on with specific populations and things we can do to prevent and save the healthcare system money and time. And then just the key stakeholders we work with is post-secondary industry, NGOs as mentioned, other ministries. We have had the best kind of benefit, as Vinna will talk about, when we partner, not just with one group, right? When we bring together expertise from those frontline care providers or post-secondary institutions or NGOs, we tend to have the best partnerships and the best outcomes. So I'm extremely excited that with all of the work that we've been doing in the background with the health system, we were still able to develop this really positive partnership with Novartis. So I'll hand it over to my colleague, Vinna, who is going to talk to us about cardiovascular disease.
Sorry, I think, Kim, you're still on. This is the prep.
Oh, sorry. My sincerest apologies to everybody. I will just continue telling you about this. So in discussion that I mentioned just previously about aligning to our priority areas, cardiovascular disease is the #1 killer and leading cause of hospitalizations in Alberta. It is a significant cost to the system. It's also terrible for patients, right? It leads to all kinds of secondary health issues, including, an inability to go to work, heart failure, all kinds of physical and also mental issues, including depression and anxiety. And so when we started talking to Novartis about this, one of the things that we'd said was, it's really important to us that we look at our big disease groups. And one of them is ASCVD, so atherosclerotic cardiovascular disease. And so that is, myocardial infarctions, angina, all kind of the things that clog your arteries and make you sick and unwell. And so one of the things that we said, talking about our principles, trying to improve outcomes, focus on prevention, we partnered with Novartis and said, can you help us figure out a way to improve patient care at the front end, right? And the best way to figure it out is to actually look at the data. And so what we did was we used data to be able to figure out what's going on. And so what we did was look to see that, elevated LDL cholesterol is really bad. I learned that from the doctors. And that even though people have this, lipid lowering medications, we still see all of these patients who end up going on to have secondary poor outcomes, right? And so we're trying to figure out what is going on. So patients maybe don't understand the risks. There is fragmented communication amongst the system, and that's when I talk about interoperability and digital enablement. And then there's a limited ability to figure out what's going on and then evaluate those. So we basically asked Novartis to help us figure out how we can work together to proactively support patients with a patient-centered approach to look at preventative care and how they can better manage their disease before they go on to have hospitalizations and terrible outcomes. And with that, I get to pass it over to Vinna.
Thank you, Kim. So thank you everyone for being here today. I think many of you are probably wondering, why is Novartis here? What do we have to do with health system transformation? Or some of you have maybe even started to Google what and who is Novartis. So for the next few minutes, I'm going to take you through those answers to the very valid questions. So on the first slide, you'll see here, we're going to start with who we are. So Novartis is an innovative medicines company with one purpose, and that is to reimagine medicines and improve and extend people's lives. So we are one of the top 5 pharmaceutical companies in the world. Our medicines reach more than 250 million people worldwide. And the reason why we're called an innovative medicines company is because we focus heavily on research and development. So you can see by the stats there, we are relentlessly innovating and investing in really cool, innovative technologies and making scientific breakthroughs that are super mind-blowing to me. But this is done with the goal to bring new and advanced therapies to the right patients at the right time. And in Canada, we also have a large footprint. And the reason why we're here taking part of this webinar with Alberta Health is because at Novartis, we don't think of ourselves just as a pharma company. When we look at care delivery and we look at the patient journey, we know that we too have a key role to play in that. So we've started to shift our mindset, our strategies, our investments into supporting a population health and more collaborative approach to patient treatment and care. And we've started to establish partnerships with governments and healthcare organizations across Canada because we want to demonstrate our commitment in being a health system partner and the role that we play within the system. So next slide. So there's many different stakeholders and partners on the call today. And regardless of your organization you represent, at the end of the day, we all have the same goal, and that's to deliver better outcomes for patients and to create a better future for healthcare in Canada. But there's not one organization that can do it alone, and especially in this tech and data-driven world that we live in today. So if we want to come closer to reaching that shared goal, we have to work together. We need to form partnerships and collaborations that span both the public and private sector. And that was the mindset and thinking and the catalyst behind the creation of the biome. And the Novartis biome is our innovation hub. It's our central front door for digital and data partnerships. It was established as a bridge between Novartis and the healthcare ecosystem to facilitate better collaboration. And as you are all aware, I think many of you on this call today are from the public sector. Provincial healthcare initiatives and projects are often challenged by the lack of capacity, a lack of funding, and competing priorities that are often hindering success and that results in delays and additional costs. And you're probably dealing with these challenges as we speak. This is super familiar to me. I led many provincial initiatives in my past life. So on the next slide, you're going to see where Biome has been able to really add value. And that's by helping healthcare organizations accelerate their priority initiatives through these innovative partnerships. And the formation of these partnerships allow the right capabilities and resources to be brought to the table. Sorry, can you go back, Sam? To be back to the table to accelerate the speed of implementation, and it enables quicker demonstration of value with shared risk across all of the organizations. So I don't think this concept of partnership is new to anyone, but Canada operates, as we all know, in a very risk-averse environment. So this impacts innovation and progress. So if we want to build a better future, then we have to be more bold. And I just wanted to commend Kim, Minister Glubish, and Alberta Health for being bold, for recognizing early on the value of data, the value of partnership, and then having the tenacity and the guts to actually partner with industry to propel things forward and get things done in Alberta. And this Alberta Data Project is a perfect example of that. So on the next slide, so you heard Kim speak about ASCVD and the burden and the impact that it has on the health system, and at Novartis, cardiovascular disease is one of our priority areas. So we partnered with on a shared objectives, using data-driven approaches to design a population health management model for patients with ASCVD. The project was designed to get some more insights into some fundamental questions. How do we evaluate the care gaps and the impact that new care models and initiatives could have? How do we create a more integrated model of care for patients with ASCVD and ensure that they're being managed optimally? And as we all know, Alberta is generating a wealth of healthcare data. But what is the quality of that data, and how can the system harness the power of that data for better planning, better care delivery, and an overall better patient experience? So on the next slide, you're going to see the 3 phases of the project. So we started phase 1 in 2022, and the first phase was focused on understanding the prevalence of ASCVD in Alberta using data. I just want to say thank you to Kim and to her team, who did a fantastic job at analyzing the data and working on this. And just a disclaimer, Novartis did not have access to any patient level data. We only received the aggregate results, which I'm about to share with you in the upcoming slides. The data remained within the walls of Alberta Health and the analytics team. So just a disclaimer. From the data in phase 1, we understood there is a growing pressure on the healthcare system, and there's an increasing proportion of the population that's actually being impacted by ASCVD. So we decided then to move on to back up to phase 2 in 2023, where we actually got the privilege of working with our partners at AHS, and that was to link the prevalence data with the lab data. And that was to further understand how patients were being managed and what proportion of patients had LDL-C levels above or below the CCS guidelines or recommended thresholds. So we completed phase 2 at the end of 2023, and we're working closely now with Alberta Health, and we'll be engaging a more broader stakeholder group on phase 3, which is focused on the opportunities to leverage, as Kim had said, digital health solutions and tools to automate the identification of patients, put them on an optimized pathway, and then ensure that they're being managed and treated appropriately. Before we get to the results, I just wanted to kind of make something super clear, and maybe it's the elephant in the room, but this project, the models and the pathways that are being put in place are all drug agnostic. There are a lot of regulations in pharma. As you may know, we cannot link projects to medications. So as I said earlier, Novartis is taking this very different approach to the way that we engage in the healthcare system. And we're doing this because we wanted to show our commitment and our dedication in being that health system partner, regardless of the treatment options. So I just wanted to kind of make that clear. So maybe we'll move on to the next slide. So these are the results from phase 1. As you can see, the burden of ASCVD is growing. Over the past 11 years, the prevalence of ASCVD has grown by 24%. So when you think about hospital visits, surgeries, lost time at work and with the family, and the overall cost, these are all significant burdens and pressure to the system, to the patients, and to the citizens of Alberta, and they are only going to continue to increase, and that's going to make it unsustainable in the very near future. The next slide after this shows the results of phase 2, which were also very interesting, and provides information on the state of care for patients in Alberta who are living with ASCVD. So in 2021, 2022, there were about 54,000 Albertans who had suffered and survived an acute coronary event. So that's over 100 patients each and every day. And based on some CIHI data that we have, I think on average, those who have suffered heart attacks are going to actually spend about 5 days in the hospital following that event. So again, lots of pressure on the system, on the families, and on the patients. And these 54,000 individuals here are actually at high risk for subsequent major cardiovascular events. In addition, most Albertans living with ASCVD, so over 60%, do not meet the Canadian guidelines for healthy cholesterol management. So over 25% of these patients have actually not had their cholesterols checked in the past year, despite being one of the highest risk groups, meaning there is a gap here. So why are they not getting it checked? Is it an access or equity issue? Are they the ones that are falling through the cracks? Like, how do we catch them? And the data also shows that less than 50% of Albertans who are living with ASCVD are on lipid-lowering therapies. So Kim said these lipid-lowering therapies reduce the risk of subsequent events. So these patients are actually at high risk for a secondary event and other compounding health issues, putting them back in the hospital with more complex conditions and requiring greater care. So it's obvious that there's a common theme and there's a common problem here. So what are we going to do with this data, and what does this all mean? So for us in Novartis, this project is a demonstration of the opportunity that we have, I think, as a collective to implement more optimized and integrated care models to leverage the power of data and smart technology and provide care to patients when they need it and manage them along their journey. So that is what phase 3 is all about. And on behalf of the Novartis team, I just wanted to say thank you. It's been amazing working with Alberta Health and Alberta Health Services, and we look forward to continuing this journey with you. So I'm going to pass it on to Kim to close off the presentation. And if you have any questions on the data, I think there's Q&A afterwards that you can ask. So thank you.
And I think when we go back to those 3 steps that Vinna was talking about, we use the data to make informed decisions, right? And obviously, as an epidemiologist, this is something that I'm passionate about. So using the data to understand the problem allows us to go to the next phase, which hasn't started yet, which is like, what is the solution to help people, right? And looking at this specific patient population, what is the digital or non-digital option that helps them manage their health better? And so based on those findings, as you can see here, there was a clear call to action, right? And one of the physicians who was involved with this said, I thought my patients were better managed than this. I had no idea. And so, if we go to the next slide, I think this really aligns to what we're trying to do as part of Refocus and part of the system, is to make sure that, whatever our health workforce is that we enable them in the best way possible. And part of that is by enabling patients to take control of their own health. And so having that seamless patient journey and experience, using digital and data to support that, helping physicians, nurse practitioners, and other care providers to know when their patients aren't being managed well for, cardiovascular disease or anything. And then again, if you look at those bottom 3 pieces, this is all aligning to that work, right? This will reduce costs. We want to support equity across the system and ensuring that people, no matter where they live or what their background is, will be able to be supported through whatever changes we make. And then, of course, all of this prevention is just so much healthier for the individual, but also for our population as a whole. So I think with that, this was such a positive and wonderful collaboration. There's always bumps in the road for things like data access and how do we do these things and what's going on and explaining it to people. But I would really like to thank Novartis for their patience. Working with government is not for the faint of heart. And so we persevered. And I think we hear it from the people who've been involved in this work that it has been a success. And we're super excited to figure out what the next phase might look like. So with that, thank you so much, everyone, for your time.
Great. Thanks so much, Kim and Vinna. Let's get started on some questions. We have a couple already in the Q&A tab, but I do want to encourage everyone that if you have a question on your mind, now is the time to go into the Q&A tab and type it out. So I'll start off with the first one. They're just asking about hearing a little bit more about the digital, like specifically about the digital solutions that were part of the intervention.
So I can start. I think on the digital side, that's in phase 3. So in the first 2 phases, it was really just taking the data that we had already had and we would say manually linking them together. So using our data scientists and Alberta Health and using sort of the traditional analytics methodologies. It's in phase 3 where we're really going to look at the opportunities to digitize this. So within the EMRs, or what does that look like in synergies with the electronic health record?
Okay, great. Thank you. Okay, so we have another one. This is a really good question. So they're asking, how should the process be updated by others based on recent advances in data mining, cleaning, and prediction? For example, do you see that the labor-intensive phase of determining which patients need intervention to receive the best care could possibly be streamlined by natural language process or large language models?
Yeah, so I'll take that one because I like data the most, I think, Avina and I. So one of the things we're doing as part of Refocus is actually modernizing our analytics environment. And I know there's a few people from Alberta Health and Alberta Health Services, so I would like to give a strong call out to Alberta Health Services for just the exceptional work that they've done with their data quality, master data management, data infrastructure, etc. Alberta Health is trying to catch up. And as part of that, the sort of reward I've told everyone they get at the end is the ability to use much more machine learning and AI to be able to do things. And so absolutely, I think that we would have done this what we would call the old school way. But there is definitely the ability to do much more data mining, much more predictive analytics, and definitely modernize things. And Alberta Health has already started to partner with groups like Alta ML and Amy, who are local experts here, and we really do want to drive to be able to do that. So if there's people who have expertise or insights that want to talk to us, we'd be happy to hear from you guys for sure. So that could be for the next time we partner with Vinna and team.
Yes, there will be a next time.
Great, thanks. All right, we have a few more here. Okay. So first to comment, they said this is terrific. And then they're asking, how are you communicating the results to providers so that they can action who needs what follow-up care? And they're curious about how this is being done or planned.
Do you want to start, Kim, and then I can add to it? Or do you want me to start? You go ahead.
Go ahead, start.
I think for the next phase of automation, so we are looking at it's not about communicating these to providers. It's actually about integrating this type of work into their workflow. So creating the care pathways in that integrated care model where we don't have to take historical data, do data science on it and then give it to them. It's going to be within their workflow. It's going to be real time, and they're able to identify their patients and who are at risk, and then through digital means and digital tools and solutions, refer them onto the right care pathways and then monitor them throughout their journey. So that's really going to be, I would say, the vision for the phase 3 and for the automation of it.
And one of the things, thank you, Vinna, that was great, that I just want to add is that this is not going to be forced on providers, right? And so the idea is that these are people who are interested in partnering with us now. There may be a future state where, especially for big diseases like cardiovascular disease, that is a chronic disease you have to manage forever, that there is some kind of push notification to physicians or other things. But definitely for this, these are people who are interested providers in trying to be able to find better ways to deliver care to their patients that are not more paperwork, and also empower patients as well, right? And so part of that is also trying to figure out, in a more distant future state, do we leverage things like My Health Record and other stuff so people can be notified and aware of what's going on? I mean, we're really at the beginning of digital transformation in Alberta. We were a leader, we are a leader, and we're going to continue to push that. So there's all kinds of opportunities in a future state.
Okay, great, thanks. And I think this has already been answered, but they were just asking about, will the next phase include automation to any type of virtual care support for at-risk patients, such as remote care monitoring, which is essentially what you have just answered. Okay, we have a couple more coming in. So this one's specifically for Kim. They're curious if AH has gone to look back at other fiscal year data to see if the trends continue beyond the one time point that would have overlapped with the pandemic. Obviously, access and patients seeking care could have been an issue during this time.
Yeah, absolutely. We don't have to go back to the slide, but there is a slide that actually just shows the increasing number of people with ASCVD. So absolutely, like, I mean, pandemic just messed up all kinds of things, including the data, which breaks my heart. But also a super interesting opportunity to look at health seeking behavior more generally. But what we did, and Vinna didn't get into all the details, is we actually looked at lab data, physician billing data, hospitalizations. Like, we looked at a whole bunch of different data sets so that we weren't relying on one that might be skewed. And I think I also mentioned, maybe I didn't, PIN and pharmacy subscription filling, etc. So no, I mean, obviously it's a global trend that cardiovascular disease is increasing and has been for decades, and it's part of an aging and somewhat unhealthy population that we all have. And so Alberta is not an anomaly in terms of its growth, but we did definitely look pre-pandemic. I think the numbers that Vinna talked about were just in the most recent fiscal year that we had, 21-22. But to your point, we did look at data trends from before, and Alberta Health has some really exceptional analysts who also look for anomalies in the data, right? We don't want to make mistakes and then offer that up for decision making for patient care. That would be bad.
I think I can answer the next one about phase 3. So as I had mentioned, I think, we're in the very beginning stages. We had just finished phase 2. So we are working with Alberta Health on identifying who those partners are. It will be a very much more broader stakeholder group because, we really want to get the clinical community in there. We want to make sure the right stakeholders are represented. So the answer is yes. To that question.
Okay, great. Yeah, that one was just on asking if the objectives, partners, pilots for phase 3 have been set already. So, okay, awesome. Lots of good questions. I have another one that just came in. All right, great. First of all, they're saying thanks for sharing, that it's relevant and timely. So the question is that primary care physicians have so many responsibilities that it can be overwhelming. The challenge in primary care is that you have patients with multiple morbidity. And so I could see opportunities for this approach to better support the management of diabetes, COPD, heart disease. And the question is, does the system flag individual patients that are missing cholesterol-lowering therapy in order for the physician to action?
Sorry, is the question of the system and now, like right now, or the future state of phase 3?
I guess it's current, but it could be, I know for the future phases that it is planned to do that kind of thing, right? The flagging?
Yes.
Mm-hmm.
It's more of a proactive approach for sure.
Yeah. And this can definitely be used as a model for, we know that most people have multiple chronic diseases, right? Alberta has done some really good work with congestive heart failure pathways. And one of the things we learned is that people don't just have congestive heart failure, they also have COPD and diabetes and all these other things. So as part of this is some of the great work that Novartis has done with us, is looking at, people who have ASCVD, but also have diabetes and other things. And so there's really a lot of opportunity once we go past phase 3 to kind of expand this and really support primary care providers with chronic disease management, and also empower patients who, want to take control of their health and maybe don't necessarily know how or what to do.
Mm-hmm. Thank you. This kind of leads into another question that we just got. And they're referring to patients who may not have been proactively managed for many years. And so they were asking, is there any part of the future plans to try to proactively identify patients as risk? I'm guessing patients who have not already been identified as having chronic health issues.
Yes. I mean, I can pass it to Kim, but like I would say that definitely that is part of the plan.
Okay, excellent. Okay, amazing. We got a lot of really good questions. Very active audience. Okay, I'm not seeing any coming in currently, so I will just quickly share my own screen and a quick poll. If here we go. There's just a quick satisfaction poll just to give a score out of 5 for the presentation, which I believe was really excellent. Thank you so much, Kim and Vinna today for speaking. That was really interesting. Okay, I'll just give people a few seconds to answer this poll. Okay, great. And we do have a longer survey that we'd really appreciate it if you're able to fill out today. This will also be emailed. I'll be following up to everyone who is on the call today to share with you the recording of the session as well as this feedback survey. We'd really appreciate it if you take just a moment out of your day to fill this out, and I'll leave it up for just a couple seconds longer. Otherwise, you'll also still be receiving it in an email. All right, great. Okay, just to promote a little bit of Digital Health Canada news, we do have our online community. We'll be sharing the recording, as I said, in an email, but it will also live in our online community. So you'll also be able to access previous webinar Wednesday recordings and connect with other members of the community.
Great.
All right. Thank you so much again. And I guess with that, we will wrap up for the day.
Thank you, everyone. Thanks.
Bye, everyone. Thank you.
Bye-bye.